Did you know that the number of obese children worldwide has increased tenfold in the past 40 years? This alarming statistic is more than just a health concern. It's a clarion call for immediate action. Childhood obesity is more than just a few extra pounds on a child's frame. It's a heavy issue that can weigh down a child's future. In a world where the number of overweight children has tripled since the 1970s, it's clear that we're up against a growing challenge. But what exactly tips the scales towards childhood obesity? And how can we tip them back? The root of the matter, exploring the causes. Let's dive into the calorie-rich, nutrient-poor pool of causes that contributed to childhood obesity. It's not just about what children eat, but also about their lifestyle, their environment, and even their genetics. Caloric consumption versus caloric expenditure. One of the most straightforward explanations for obesity is an imbalance between calories consumed and calories burned. Fun fact, did you know that it takes a 3,500 calorie deficit to lose 1 pound of fat? But achieving this balance is anything but simple. Children are consuming more high-calorie, low-nutrient foods than ever before. Fast food, sugary drinks, and snack foods are not just occasional treats. They've become dietary staples. The sedentary shift. Physical activity has taken a backseat in many children's lives. With screen time often exceeding green time, kids are moving less and sitting more. The rise of video games, online social interactions, and on-demand entertainment means that the playground is losing out to the PlayStation. Home environment and parental influence. Children learn habits from their surroundings, especially from their parents. A household where fruits and vegetables are scarce but processed foods are plentiful sets the stage for unhealthy eating patterns. Similarly, if family activities are more about movie marathons than actual marathons, children will likely adopt a sedentary lifestyle. Socioeconomic factors. It's not just personal choices. Socioeconomic status plays a role too. Lower-income families may have limited access to healthy foods or safe places to play and exercise. Additionally, higher-calorie foods tend to be cheaper, making them a go-to for families on a budget. Genetic predispositions. Yes, genetics can also be a contributing factor to childhood obesity. Some children are genetically predisposed to weight gain and may find it more challenging to stay at a healthy weight. The fight against childhood obesity. Strategies that work. Now that we've identified the culprits behind childhood obesity, it's time to rally the troops and fight back. Here are some effective strategies that can help turn the tide against this epidemic. Nutritional knowledge and choices. Education is a powerful tool in any battle. Teaching children about nutrition and the importance of eating a balanced diet can empower them to make better food choices. Encouraging families to cook together and explore new foods can turn healthy eating into an adventure rather than a chore. Making movement a must. Exercise should be a non-negotiable part of every child's day. Whether it's organized sports, dance classes, or simply playing outside with friends, kids need to move to maintain a healthy weight. Schools and communities have a role to play here by providing opportunities and facilities for physical activity. Transforming the home environment. Parents can lead by example by adopting healthier habits themselves. Swapping out the cookie jar for a fruit bowl or planning family activities that involve walking or biking can have a profound impact on children's health. Addressing socioeconomic disparities, public policies and community initiatives can help address the socioeconomic factors contributing to childhood obesity. Community gardens, subsidies for healthy foods, and improved urban planning to create safe play spaces are all strategies that can help level the playing field. Medical interventions and support. For some children, medical interventions may be necessary. Healthcare providers can offer guidance on diet and exercise, monitor progress, and in some cases prescribe medications or recommend surgery for severe obesity. The future is in our hands. Childhood obesity is not an insurmountable problem. With concerted efforts from parents, educators, policymakers, and communities, we can shape a healthier future for our children. It will take time, patience, and commitment, but every step towards a healthier lifestyle is a step away from obesity. In conclusion, childhood obesity is a complex issue with multifaceted causes ranging from individual behaviors to broader societal factors. However, by understanding these causes and implementing targeted strategies to promote healthy eating and active living, we can fight this epidemic. It's important for everyone, parents, educators, policymakers, and communities, to work together to create environments that support healthy growth and development for all children. By taking action now, we can ensure that today's youth have the opportunity to lead healthy, fulfilling lives well into adulthood.